This is also EMS week, and of course we've been making sure we recognize the folks who are in our emergency rooms, and I'm trying to make sure I've got a pen right here, good deal. Recognize the people who are in emergency rooms, who are emergency responders, whether they're the professionals or the volunteers. They are on the front lines of combating the virus. They've got very, very difficult jobs. We are so grateful of all the hard work they are putting in all across the state to be able to take care of people and keep people healthy and safe. And so we want to say thank you to all of our EMS folks. And so I am going to sign a proclamation declaring it a Emergency Medical Services Week here in Nebraska, to say thank you to all the folks who are working so hard to keep us safe. And so here's our proclamation. And we also have Dr. Jim Smith, who is with Great Plains Hospital in North Platte, who Great Plains has been doing a fantastic job of helping us take care of people as well. Just one of the things we've had here in the state is just wonderful cooperation with all of our hospital systems. Great Plains has been no different. They have been great in working with the hospital in Lexington to be able to take patients and so forth. So we really appreciate all their work. And Dr. Jim Smith is the chair of the EMS board. So he is going to come and accept this proclamation on behalf of the EMS board and then say a few words about EMS week. So Dr. Smith, I will present that to you. Thank you very much.
Good afternoon. My name is Dr. Jim Smith. I'm an emergency medicine physician, and I practice at Great Plains Health in North Platte, Nebraska. I'm chairman of the Emergency Medical Services Board for the state of Nebraska, and I want to thank Governor Ricketts for the opportunity to serve in that capacity and the opportunity to speak with you here today. I first wanted to give you some historical perspective about EMS Week. President Gerald Ford, the 38th President of the United States, a Nebraska native, declared the first EMS week in November of 1974. So I think this week holds special meaning for EMS providers throughout the state of Nebraska. If you will bear with me for a moment or two, I'll try and describe to you what actually happens in Nebraska when you pick up the phone to call 911. First off, a dispatcher has to quickly try to gather the critical information needed from an often distraught caller to determine which assets to deploy to the location. A law enforcement officer may be the first to arrive at the scene, rendering life-saving treatment in the form of CPR, defibrillation, administration of Narcan for opioid overdoses, or to stop active bleeding while EMS is en route. EMS providers then arrive, and depending on the location, may be a level from anything from a first responder, EMT, paramedic, or even a nurse that is offering to help in the EMS world, along with firefighters that assist in that care and oftentimes have to extricate victims while care is being given to the patient. The patient then is rapidly transported to the emergency department while treatment is rendered in a moving vehicle or the back of a helicopter. That's not an easy task. There, the emergency department hospital staff, often including in-hospital EMS personnel, treat and stabilize patients. Unfortunately, some patients' injuries and illnesses exceed the capabilities of that hospital, and again, EMS personnel are called upon to transport those sometimes critically ill patients to a higher level of care. Here, EMTs, paramedics are sometimes joined by respiratory therapists or nursing staff to aid in the transfer to definitive care. Now that's a lot. That's a lot of moving wheels. That's a lot to do. But I want you to consider this. Those assets couldn't respond to calls without dedicated maintenance personnel to keep those ambulances and aircrafts at mission readiness. There are then ambulance drivers and aircraft pilots that have the difficult task of quickly transporting that precious cargo to their ultimate destination timely and safely. Now, none of this could happen without non-clinical support staff in offices, hospitals, EMS bases, fire agencies, government officials and offices like DHHS, the EMS board, and medical directors all working across the state to support the system. Least we not forget about training agencies. They work tirelessly to keep our EMS staff trained to the best of their abilities. But at the end of the day, Some soul has to make the conscious decision to answer the call. The call that means putting their lives and well-being on the line each and every time they do so, especially during our current pandemic. Lastly, there's always somebody left behind, a spouse, partner, child, parent, or friend that watches them walking out the door and wonders if that'll be the last time. They hope and they pray for the patients that they're caring for and for the safe return of their loved ones. Nationally, the 2020 EMS Week theme is Ready Today, Preparing for Tomorrow. This theme was developed long before the COVID-19 crisis. In particular meaningful now is that what the EMS community is doing to support the affected areas by this crisis, all while still responding to the everyday emergencies that continue to occur in their communities. And now they're dealing with new challenges such as lack of access to appropriate PPE and fellow workers who are stricken with this virus. Now more than ever, it is important that we honor and celebrate our EMS professionals who are supporting the health and well-being of our state and our nation, especially those brave individuals who give the ultimate sacrifice with their lives. Thank you.
Dr. Smith, don't forget to take your proclamation with you.
Thank you.
Great, thank you very much. Appreciate Dr. Smith, you coming to be able to talk about how important our EMS folks are and their great work and help us recognize them for their work here today, especially during this pandemic. So thank you very much. And thank you for serving as chair of the EMS board.